Good evening. How are you all? Good. Well, thank you, and I want to really start by thanking you for your interest in tonight's topic on safe sleep for infants. And our speaker tonight is a professor of pediatrics, practicing in both pulmonary and sleep medicine at Children's Hospital Colorado. She is the director of pediatric sleep research at both Children's and the University of Colorado. On behalf of Summit County Public Health and Early Childhood Options, please join me in welcoming Dr. Ann Halbower.
Thank you. Thanks very much. I don't think I need a microphone, but let me know if you can't hear me. And thank you very much for inviting me. This is a topic near and dear to my heart. We do a lot of research in infant safe sleep. We have helped to shape some of the legislation around it that is a little hard to swallow for some daycare centers, and so we can talk about that tonight if you'd like. We have a lot of data that's been gathered over more than 20 years on infant safe sleep, and unfortunately in America we did not focus on all of the things that actually protect infants, and we focused on the Back to Sleep campaign. So everybody's heard back to sleep is good, but there are a lot of other things that make infants in danger, and will also will educate people on how to improve their risk. So I would like to discuss risk factors and protective factors for sudden unexpected infant death, and we will be defining that in a moment. We'll also identify common misconceptions about infant risk and safety and share some recommendations and resources for you. So in the olden days, we called this SIDS, Sudden Unexpected Infant Death Syndrome, and SUID is a little bit different. So SIDS is the sudden death of an infant under 1 year of age that remains unexplained even after a thorough case investigation, including a complete autopsy, examination of the death scene, and a review of the clinical history. Unfortunately, in many counties throughout Colorado, we don't get that complete death scene examination. It's been hard to classify some of these deaths as SIDS because in many cases the infant was accidentally suffocated or would accidentally fall, and it got lumped into one category, a wastebasket category. So now this is called sudden unexpected infant death, or SUID, and this is the death from all causes that includes accidental suffocation, non-accidental trauma, etc., but it's unexpected. And it is the #1 cause of death of infants between 1 month and 1 year of age. So I like to start out my talks with a quiz. And this is a quiz, and you get to tell me what you think, and then we'll talk about the answers throughout the talk. Which is more dangerous? A non-smoking, non-drinking mother, age 30, sleeps with her baby to promote breastfeeding, or B, a 16-year-old mom puts her baby carefully face up on the couch after feeding at 3 a.m.? How many want to say A? Some very shy people putting up their hands. How many say B? How many say both? Okay, we're going to talk about that in a minute. Here's another quiz question. Which is not associated with SUID? A, propping a baby on a pillow in the bed to prevent reflux. B, co-sleeping with the baby. C, using a pacifier. D, covering the head with a blanket. And E, using a crib bumper. How many say? Oh. You got 100 on that. All right. So sleep-related infant deaths are sudden and unexpected infant death, and they mostly occur during sleep. And this is often because there is suffocation, strangulation, or entrapment, but also there is lumped the undetermined category. There are risk factors that make SIDS and SUID more likely, and many of these we can't control. For instance, premature birth is a very high risk for SIDS. Low birth weight young age of mother, African or Native American mothers have the highest rate in this nation, recent infection in the baby, and unemployment in the household. These are all risk factors, and they're very hard to control. In Colorado, there's about 50 deaths every year from SUID. It's twice as common in African Americans and Native Americans, but in Colorado, the majority are white parents in their 20s to 30s, so they don't fit the mold that the rest of the country seems to see. The risk of accidental suffocation is increasing in Colorado and nationwide, and a lot of that is due to unsafe sleep environments and also co-sleeping babies with parents. There's several factors that relate to sleep-related infant deaths, and these are more than additive. And almost half of the deaths in Colorado that we collected data on had more than one unsafe factor in their sleep environment. For instance, they may have been bed sharing, they may have been put to sleep on their stomach, and they may have used soft bedding. There have been now hundreds of studies of SIDS over the last 20 years, and here's just a few of them. And there's been data collected in these association studies where they look at children who died of SIDS, and then they age match them to normal controls that were in their own community to look and see what it was that made the kids who died different than the kids who survived. When you look at all these association studies, there's a huge effect of environment that is causing the risk. There's also a huge effect of age and sleep. So obviously, sleep is part of the diagnosis, but the age is linked to an immature nervous system. So infants are born with an immature nervous system that develops over the first year of life, and that actually has involvement in breathing and in heart rate. Cardiorespiratory control can be unusually slow to develop in some infants, especially preterm infants. Some kids are genetically inclined to be in danger. Those are kids, for instance, that have been born with calcium channel problems in the heart and metabolic disorders. All of those can lead to some increased risk of SIDS. But if you look at the circle on the environment, this is not only one of the largest known associations for SIDS and SUID, but also it's the easiest to control. So the whole idea behind looking at these environmental studies was started because it was noted in the late 80s that infants that were being raised in Hong Kong who were sleeping on their back had an unusually low SIDS rate. And people said, well, why is it that those babies have a low SIDS rate? And they tended culturally to sleep on their back, and of course nobody knew if that was the factor, but that was unusual when you compared it to Europe. This led to the New Zealand cot death study that started in 1987, where they looked at 485 SIDS cases and 1,800 controls, and they found an association between death and smoke exposure, excess thermal insulation, and the prone sleeping position, which means sleeping face down. Some risk factors for infant death cannot be controlled or can be controlled, and this is where these studies led to the environmental changes that you know as the Back to Sleep campaign. It was found that infants that were dying in these studies were more often exposed to cigarette smoke. Smoke exposure during pregnancy and after birth more than doubles the risk. Smoke changes the brain areas that are responsible for breathing, so the cardiorespiratory control is different. It increases lung inflammation, and even marijuana smoke is a pollutant, changing the sleep-wake cycles, and we don't know enough about it yet to say if it's safe or not safe in infants. Just as a definition, I'd like to define that supine is when we sleep on our back, and prone is when we sleep on the stomach, so that we have the definition right. And It's the prone position or sleeping face down on the stomach that was found to be abnormally high risk in infants. What's very scary and what's new information is that normal infants sleeping prone have this very high odds ratio for death. But former preemies, when they're sent home, if they're put on their stomach, they have 80 times the risk of sudden death. And this meant we needed to focus on this particularly vulnerable group of infants who used to be preterm. Infants placed on their stomach when they're not used to it, often by other caregivers, had 18 times the risk of death. And so babysitters, daycare centers, other caregivers, grandmothers, and putting the kid on the stomach when they weren't used to it. Now, there are some benefits to sleeping prone, and you'll hear parents tell you, my baby doesn't sleep if she's on her back. We know that prone sleep increases sleep duration, and we know that it decreases waking episodes. It's actually normal for us to wake up after every sleep cycle, and infants tend to wake up about 10 times a night. They're supposed to. And the concern is that when you put them on their stomach and they don't wake up enough, that sometimes they don't wake up at all. There's also reduced heat loss when infants are sleeping face down. And the scary thing about that is people think that's good, reduced heat loss, but it's actually bad. Infants need to vent their heat. And if they get overheated, that's one of the risk factors. There may be fewer apnea spells sleeping prone, but the data is not good. And there may or may not be less reflux sleeping prone from the stomach. But again, the data is not good. The dangers of sleeping prone is, as I outlined, first of all, babies don't wake up as often when they are on their stomach, and they should wake frequently because without waking, it increases death. But also, babies have to turn their head to breathe when they're on their stomach. So if a baby's lying on their stomach, they have to flip their head to the side in order to breathe, and this actually closes the airway, increases airway resistance, and makes it harder to breathe. And also, babies who vomit while they're on their stomach are actually more likely to choke and less likely to swallow. This is an example of a picture of an infant sleeping on the stomach, and if you see, when they're on their back, their airway is actually up above the vomit bolus, whereas the vomit bolus comes from the stomach. And it's, if they're on their stomach, it may track right into their airway and down into their lungs. The other thing that's interesting is that babies who are sleeping on their back, if they vomit, they're more likely to swallow and gag rather than sleeping through it. There were studies done in the early part of the 2000s showing that pharyngeal collapsibility is increased in the prone infant, and it's worsened by the infant turning their head to the side. And so pharyngeal collapsibility may be one of the causes of the increased risk. There's a reduction in swallowing and coughing with decreased protection of the airway, decreased arousal from sleep and responses to abnormal blood gases. And here's what we all do in the hospital, right? We elevate the head of the bed. And so what happens when you do that is decreased blood pressure, and it's actually worsened by elevating the head of the bed. And so over time, this became a recommendation that from the American Academy of Pediatrics that we stop propping babies up. Babies also are at risk with hyperthermia. When kids get hot in a very hot bedroom or overwrapped in blankets, or if they have a lot of head covering, which is where they vent their heat, they actually can have hyperthermia, which decreases their sensitivity to carbon dioxide, decreases their cough reflexes, and it increases their periodic breathing. If you live at high altitude, you probably have seen infants' periodic breathing, because the higher you go in altitude, the more the infants will take a pause, then breathe, then pause, then breathe, then pause. Now we see it commonly at high altitude. If you go to high altitude, the higher you go, you'll probably start doing that as well. Infants are more likely to do that, and if they're hot, they do it even at sea level. There's an increase in deep sleep without arousal when infants are overheated. And if you've ever been in a really hot bedroom and been asleep and remembered how hard it was to wake up, heat does that. It gets you stuck in that non-REM deep restorative sleep and you can't get out of it. And even infants who sleep prone on their stomach can get hot for some reason. The head contributes to about 40% of heat production in the infant, and it's also the site of a significant amount of heat loss in the infant. And so the head is what we want to not have covered because we want infants to vent their heat. Covering the head decreases the ability to vent the excess heat. So this is why we are trying to get away from infants that are sleeping with hats on in the hospital or sleeping with hats on at home and then having multiple blankets and wrappings. In fact, when you look at the data of the infants that died compared to the infants who did not die, SIDS infants were habitually more warmly wrapped. They slept with the heat on in the house higher. Their mothers were more likely to worry that they were cold and turn the heat up. They usually were associated with quilts, thick duvets, or blankets that covered the head, and that was associated with a very high risk. There's also a higher risk if they're wrapped up in a blanket that's thick, and the thicker the blanket, the more the tog factor or heating that can cause overheating in the infant. Covering the head was a very strong risk. Almost half of the infants that were studied in the Kesdy study moved down in the bed under the covers, or they were found with their face covered when they were found. Covering the face itself decreases arousal during sleep and increases carbon dioxide, and it increases the body temperature even if they're on their back. So face covering is bad. And if you've ever put a loose blanket in with a baby in the bed, you know they all pick up the blanket and put it over their head. They almost always do that. When the Kesdy study looked at its data, what they did was they wanted to look at infants that were not born small for gestational age, and they were not covered, their head was not covered, and so they took them as a risk factor of 1. If they were not born small but they were covered, their odds ratio for death went up to 25. If they were small and not covered, they had a slight risk of death, but if they had head covering, it went off the charts. The odds ratio for death was enormously high for infants that are born small or preterm and they get overheated. So these are what we call modifiable risk factors for this unexpected death in infants, and these are things that we can modify or change. We sleep on a soft bedding or a mattress, and I've shown here an infant who's sleeping on a sheepskin, which is one of the fancy things that a lot of high-income people are doing. They're buying sheepskins for their babies, and being on a sheepskin prone is a very high risk. Bed sharing with one or more people increases the risk, especially if they're children or animals that the infant is sleeping with. The risk of death is increased if the infant sleeps alone in an adult bed. But it's also increased if the infant slept in a separate room away from the mother, which is what Dr. Spock told my mother to do with me. And the risk of sleeping on a sofa carries an extremely high odds ratio of death. And that was the answer to that first quiz question, because a teenage mom breastfeeding her baby at 3 in the morning is very likely to fall asleep, and so is that baby on the couch. And babies tend to become entrapped on the couch or fall off, and that's where the risk is high. Blankets, pillows, crib bumpers, and adult bedding are considered the soft bedding that was put into the research studies. And all of these things increase the risk of SIDS, including crib bumpers. That was one of your quiz questions. It increases the risk of SIDS 5 times even if the child is sleeping on their back. It also increases the risk of suffocation, strangulation, and entrapment. Okay, true or false? An infant who refluxes is safer being propped up at an angle in bed. Good. It is true that now there is enough information and data gathering that shows that infants who reflux a lot, if you prop them up, it doesn't help reflux, but it does close their airway. And if you've seen kids in a car seat, they tend to have their head fall to one side, head fall down, stomach is squished, blah. They tend to reflux more. And car seats actually increase the risk of reflux. So does propping a baby. And in the propping itself changes their airway anatomy, but it also makes them more likely to roll down in the bed. There's no evidence that it improves reflux. In fact, the evidence was very poor for that. Car seats have been shown to increase reflux in infants, and airway instability happens when the head falls to the side and children roll to the bottom. And this was in the hospital. This baby is wrapped up in blankets, was propped up, fell down, got covered with blankets, and look where the railing on the bed is. There was nobody in the room when I took that picture. Nobody was there watching this infant. Babies sleeping in car seats or boppies or chairs will have increased problems breathing through a tight and bent airway. And this is one of those boppy pillows that's very commonly used for infants. We have to make sure that the infant is of the right gestational age when they're using these and awake and alert, and it's being used for playtime, not for sleep. So to reduce the risk of SIDS and SUID in infants and reduce the risk of suffocation, we want back sleeping for every sleep. Side sleeping is not safe because infants who are placed on their side are very likely to roll onto their stomach, and that's especially dangerous if they're not used to being on their stomach. Supervised tummy time is very necessary for them to, not only develop but also gain really good muscle control in their head and to avoid the plagiocephaly or the flat head from sleeping on their back. So we encourage tummy time when they're awake and observe. This will enhance their motor development. To reduce SIDS and suffocation, we want kids on a firm crib mattress. Old mattresses, the older the mattress, the higher the risk. This is one of the problems we have in daycare centers because mattresses are used over and over and over again. They tend to get floppy and soft, and it's not clear why there is a risk for older mattresses. There was a theory that they were degassing some kind of a formaldehyde or an abnormal gas. But nobody's ever proven that. The other risk is that perhaps it's because they're getting soft, and the softer the bedding, the more the baby can't breathe if they're prone. We want people to use the mattress that's designed for the product. No pillows or blankets in addition or instead of a mattress in the bed. Now this is new stuff. This isn't in the AAP recommendations. They didn't go so far as to say don't use a blanket, but in all of our research in children who died in Colorado, we find that the accidental suffocation cases are usually involving pillows and blankets in the bed. Adult beds cause a risk of entrapment and suffocation in the quilts, duvets, and pillows that adults use. The use of pillows in the bed to prop an infant or to use as a mattress was associated with a significantly increased risk of SIDS, and wedges also were not advised. Unfortunately, parents are targeted by manufacturers, and if you go in to Target or Walmart, you will see these beautiful pillows and quilt bumpers and crib bumpers and pillows and everything. And what we are asking parents to do is to take that beautiful quilt that grandma made and hang it on the wall next to the baby, but to have a baby safe environment. There is a danger of pillows and crib bumpers, and infants are very likely to become entrapped. And during death scene investigations, when infants die, a doll model is used, and the parents have to show how the infant was found, and this is just a tragic way to reenact one of those death scene investigations. There are studies that show a protective effect of pacifiers, and pacifiers are also called binkies or dummies in some countries. And pacifiers seem to provide a protection for the infant. There's not a clear reason for this. I have my theory on why. I study sleep apnea in people, and there are oral devices that we give adults to pull their tongue forward or to pull their chin forward. When a baby sucks on a pacifier, it creates a suction and it pulls their tongue forward and away from the back of the throat. That's my theory. But other people have thought that it was protective because it tends to wake them up and allow them to wake up intermittently. It is important to establish breastfeeding first before using a pacifier, just to make sure that the baby gets really used to the breastfeeding, and also to consider the dental problems that occur when you're using a non-natural nipple. So baby bottles and pacifiers increase some of the palate problems, whereas breastfeeding encourages the development of these wonderful muscles up here. If you see breastfeeding babies, they have these huge cheeks. And their oral and motor and nasal development is much better, and they're much less likely to have sleep apnea than babies who have used a pacifier. Overheating is bad, and if there is a really hot bedroom, it is probably okay to encourage the use of a fan. There were studies done that showed that fans seem to decrease risk. There wasn't enough data to use that as a recommendation for everybody, but if you are visiting families that have very hot houses or live upstairs in the attic, then a fan is probably a good idea. So when we tell you not to use a blanket in a baby, this is what we're asking people to change to. And these are called sleep sacks. And they are wearable blankets or wearable pajamas. They usually zip up from the bottom so you can take off the baby's diaper and change the baby's. And we like the sleep sacks that allow the baby to have their arms free, not swaddled, but we'll get into swaddling in a minute. And also to have their head free so that they can vent their heat. We want people to avoid secondhand smoke exposure in the infant. Smoking, again, increases the risk even if it's in the environment. It's especially dangerous in the mother who has been smoking during pregnancy. Apnea monitors have not been shown to prevent SIDS, and so we don't use them here. They use them where they're sold and where they have money in the company, like Maryland. Co-sleeping is a very common cause of increased risk in all states and all countries. However, there's different ways to co-sleep. This is the American bed. The bed full of quilts and pillows, and mom's got her quilt, she's exhausted, she has this baby who's kept her up all night, so she's asleep, and the baby's trying to get into, where's my bottle? And this baby can become entrapped. And what we're trying to teach moms is that, yes, we understand you want your baby right next to you in the bed, and there is a way to co-sleep safely, and that's by putting the bassinet right next to the bed at mattress level. And if the baby can be placed into her own safe sleep environment, the breastfeeding can be encouraged. Mom can put the baby down right there and reach the baby without having the baby touching blankets and pillows and quilts. We do want room sharing, and room sharing is important because it's been shown that if the baby's down the hall away from the parents, their risk is about 10 times higher. And in Europe, they're telling people to sleep with their infants in the same room for the full year of life. And when I said that in America, I get these from the audience, but we don't know when to stop doing that, but we do know that the risk of SIDS is very high, especially under 6 months of age. We want to keep loose bedding out of the bed, including blankets, and use a sleep sack or a onesie or a one-piece pajamas instead of blankets. Breastfeeding is recommended, and it does lower the risk. And separate sleep surfaces are especially important if the parent smokes or drinks or takes drugs, because they're more likely to sleep through a bad event. These pictures were so hard to find on the internet that we had to pose this with my nurse in her house and send a photographer over there. But we're hoping that this gets to be a little easier to find. But we want people, and maybe you guys who are helping me invent things, maybe we can invent the bassinets to have legs that can be adjusted to any size bed, so that it can be adjusted to go right to bed level, so mom can plop that baby right into the bed. This baby is wearing a sleep sack. Her head is uncovered, and she can suck her thumb, and if she should accidentally roll, she can use her hands to get out of the roll. There's been a recent article that you may have heard that swaddling does increase the risk of SIDS, but the swaddling is especially dangerous in babies who have been put on their side or their stomach. They cannot move or get out of that position, and babies who are born early or who are young can't get out of that position anyway. But if they're swaddled, they can't even try to get out of that position. They're stuck there. And so the risk of death for infants swaddled is higher, especially if they're on their side or on their back, or if their head is covered. Okay, last question. Fleeing the floods in Colorado, what's the safest? Put a baby in a box, put a baby in a car seat, sleep the baby on a couch, go to auntie's house and sleep the baby in the adult bed, co-sleep with the baby in the adult bed. That's right. You may have heard that in Finland, the baby box is given out to all the babies born that sign up for the baby box. And there's been an enormous decreased risk of infant mortality in Finland with that design. And the box can be used for the first year of life for the infant's sleep. And we are trying now to get donors to help us to give these out. But everybody can get a box. And if there is need, they can use this for sleep. This is our website that we developed, and we'll be updating it with some new research from SIDS. And it's www.infantsafesleep.co. That's not .com. And there are many resources at the back of the slide set that include SIDS from the NIH, National SIDS Resource Center out of Washington, and some helpful references we can get you as well.